rather than calling doctor. You see, Aurobindo has always been, when every time I tell him that if you give me an advance notice what all you're going to talk about me, then I'll get my wife along, Like at least, because in the beginning I told him that one of the most embarrassing part of a speaker is you'll have to sit and listen about yourself, and that too, how? Because it's usually always the organizer asks the speaker, can you please send something written about you? So you yourself write about your own CV and that's being read out. So I refused absolutely vehemently. That's no introduction. Introduce me as a local Southeastern Railway Garden Reach BNR campus boy who is a doctor who wants to talk to you people, and I had asked him to introduce me as one of his good friends. But since you collected that CV from my office, I wish I would have brought Neela along next time. Next time let me bring my wife and just watch. There are some people say good things about me also, because I get shouted at home all the time. Can I have this side lights off, please, so that who is in control? Yeah, this. Today I'm going to talk about balance of life. Next, please. This is one of the ground where in the center beach I was the opener base bowler for our cricket team here. We played and we took a walk around inside the building, and I will not go into the detail about Wazir Ali Shah and the prison over here by the British and the other things about historical importance that all of you people know so well. So we shift directly to what we want to talk about. Next, please. This is the start and finish of a race called life. Many of us arrived in this world we arrived in this world crying when everybody else celebrates. We cry. And many of us will be leaving this place like this when the shutters will come down. But do we know whether others will be crying for us? Strange that when we arrived, everybody celebrated, we cried. But when we leave, do we ever think what kind of impact did we make? Because this is a journey. I just showed you arrival and departure of a journey. We should get railway passes and every summer vacation go to Puri, stay in BNR and the railway guest house, such fond memories, but little that journey in the train, we will plan it. Let's make the journey interesting. We will have puri and little sabji. We plan it what we want to eat in the train. When Kharagpur comes, should we get down from the train and have that station food? If we are planning to go with our friends, we plan it in such a way so that we have some playing cards, we have chessboard. What do you want to read in the train? Strange, that little night journey from Howrah station to Puri, we want to make it happy. What about this big journey that I just showed you? You just show the arrival and departure of the journey, a journey called life. Next, please. That was the beginning and end, but how was the journey? How many of us paused at some stage and feel maybe we have seen more than 50% of the springs that we are likely to see in this world? Did we actually reanalyze? Do we need to change anything how we want to live our life? How we want to spend this journey? Next, please. To majority of us, life has become like this. It's a horse race, it's a symbolic, but it's a rat race. We want to become more and more successful. We want to achieve everything. because who falls in the back, nobody looks at that person. We know, Jo Jeeta Wahi Sikha. So, however is the journey, however pain you are, you still want to win. If you look at the face of the jockey, he has only one thing. He has only one thing. Doesn't matter what it takes, but I must win this race. And in all our life, whether we are lawyers, whether we are doctors, whether we are surgeons, want to do more and more things, want to have name, fame, money, and achieve everything at the cost of everything, so that at the end of the day, there is only one aim in life. You must win the race. Doesn't matter how the race was. Next please. The problem, if we try to look at life, is majority of the time there is too much to do, too many decisions to take, and too little time. Next please. The main problem comes balancing all these. Balancing job, your hobby, your life, your profession, your desire, your children's, your own hobby and passions and everything. We all know, it has been clearly indicated, that if you want to measure success, what exactly is success? It is not personal wealth, material possession and social status. This is not the route to success. There was a beautiful definition which I saw somewhere, is whatever you could have achieved and what percentage have you achieved, that is what is success. You know, like somebody, a little tea shop owner, his son passes graduation, is successful. But probably you could have been the leading singer of the country, but because of your job you did not put your effort into music, you're unsuccessful, however, whatever other things you have achieved. It means you must assess what you could have done, and not in terms of material possession or personal wealth. Next please. Because there are several studies, and one of the strong studies by Mental Health Foundation has shown that working hour has increased in last decade. It's a statistics from all over the world that everywhere working hours has increased. Long hours has a negative impact on personal life and mental well-being, and it is directly positively affecting the incidence of heart disease. There was a study in Lancet that 60% of the total cardiac patients of the whole world is Indian. We get heart attack at the youngest age group. India has been declared as the diabetic capital of the world. We all know in the newspapers. Majority of us probably will start feeling thrilled. Wow, so many coronary angios to do, so many bypass to do, so many surgical problems. But that's not the way to look at life. It's not like every time there is a flood, we have so much effort to arrange for flood relief. But what we aim should be how to prevent the flood, how we can prevent heart attack, how we can prevent or live without getting diabetes, how our present day life, which is continuously we are becoming slave of working hours and other things which is affecting, is there any way of getting out of it? Next please. This is one thing which I want you people to understand, because this has become a dreadful thing. We keep talking about heart attack, but what exactly happens? It's this chips and fat and cholesterol that we are having at this moment. They go as fat globules directly from the intestine. And once this fat globules is absorbed, they get deposited in the arterial walls where all the blood vessels are going. And this deposit is atherosclerosis, which forms as a plaque. Now, there have been studies that even whole milk given to children from childhood, that starts atherosclerosis. This is pathology books shows, and then ultimately this blood cracks, all the platelets and all the blood vessels go and seal that crack. The lumen starts getting narrower and the blood cannot flow through that area. And that, because the narrowed area of the artery gives rise to this experience of tightness and heaviness and constriction of the chest. And ultimately, when that area of the artery which is getting narrower and narrower, the angina at some stage, the artery gets completely blocked, and that's one myocardial infarction, heart attack. Nowadays, many of us, when we go and do non-invasive cardiac angio, which is we are scared to put a needle, we just do an MR angio and CT angio, we doctors are shocked. Many of us doctors, we have just done recently this, looking at the status of our artery. It's just that we are moving around, it's fine. But if many of you go through this non-invasive MR angio, believe me, half the people over here might be, oh my God, this is my artery. Next please. We did a questionnaire. We basically wanted to know from different people, are you happy with your present life? We did an ask, is the pressure of work or pressure of home problems eating all your personal life? If you could turn back the clock, if at all it was possible by H.G. Wells' time machine, we go backward. Would you like to live the same life? If somebody asked me, I would like to come back to Southeastern Railway and spend my childhood again. Koi lauta de mere beete hue din. But suppose if we ask you, the kind of life that you are leading now, would you like to live the life if you get another chance? And if possible, would you change now? You feel that no, this is not the way to live. So we did this questionnaire and did a survey among Apollo doctors. We did the survey in my own hospital, the doctors, non-medical friends and relatives. You would be surprised to find, I'm not joking, this is an actual prospective randomized trial that we did, questionnaire. 85% people responded they're not happy with the present. And nearly 90 to 100% of the people has the same complaint, that there is too much to do and too little time. But railway is probably different, I do not know. But just to know a feedback, how much percentage of you people are happy with the life that you are leading? Okay. Good, right. Okay. Around 50-50, right. Not bad. This is just to get an idea that how many people feel that something needs to be changed the way we are living. Next please. We tried to calculate that why is this grumbling attitude about everybody, too much to do and too little time. We found out that in a week we have 168 hours, an average sleep of even 7 hours, average commuting, 1 hour to go to work, 1 hour to come. Here probably people are staying within the campus, but 5 minutes to go and 5 minutes to come.
Yes.
Now many of us, we did the survey that even if you commute for an hour, even if you work 10 hours a day, 6 days a week, even if you bring back work 4 hours in a Sunday or a holiday, with daily chores of taking bath and food and eating, the total number of hours were coming in a week was 132, and every week we had 36 hours of personal time. Where does it go? What happens? Why is it that whomever I ask, I met my old schoolmate, Udit. He went to IIT and he's a top shot engineer. I asked Udit that he used to play the flute so beautifully, you know. I used to like him playing the mansi. And I asked him, do you play the flute anymore? He said, no, I don't get time. I met my friend Ashok Datta. He is in Manchester now. He's a respiratory physician. And I asked him that he used to write so beautiful letters. Every summer vacation, puja vacation, whenever you will be away, your letters were filled with poetries and quotations. And reading your letters was like, it was like a pleasure so much. I said, do you write such beautiful letters anymore? Said the same thing, no, don't have time. SMS or email. We have stopped writing. Recently, I saw a survey that only 9% of the children ask their parents when they can't understand anything. Question answering from parents only 9%. 91% Google it. Google has become a verb. So, father and mother has been replaced by a machine. This lifestyle change, we realize that these 36 hours, do we pursue happiness in these hours? We study, we work hard, we want to work, we want to get a good job, make money, be successful, have a car, have a house, get married, children. At the end of the day, why? All lead to only one word, happiness. Do we ever pursue or try to understand what exactly is this happiness? Is it a realization? Is it just achieving few things? Is it a chemical reaction in brain? It's an auto-suggestion? Do you try and console yourself? No, we are happy in this place. Is it that? Next please. Because of this, there is a need for balance of life. To create time for ourselves, to create time for friends and family, rest and relaxation, health, and also most importantly for your own